Signal precision in RWPM for SaMD, thresholds, templates, checklists. Welcome! Today we're connecting real-world product monitoring, RWPM, with software as a medical device, SaMD. RWPM watches how products perform outside the lab, where real patients, real workflows, and messy data live. SaMD teams rely on timely, accurate safety signals to catch problems early without drowning in noise. When signal precision is high, you reduce false alarms that waste time and avoid missed risks that harm users. The goal is simple: detect issues quickly, decide with confidence, and act fast. Patch software, adjust labeling, or escalate, so patients stay safe and teams stay compliant. Start by defining what counts as a signal versus routine noise. Put numbers on it. Use rates, events per 1,000 uses, severity levels, and time windows to see spikes versus slow trends. Build baselines from historical performance and external benchmarks, so normal is grounded in data, not guesses. Then lock in review cadences: daily for critical, weekly for moderate, and clear escalation paths to safety, engineering, and regulatory. When thresholds are explicit, your team knows exactly when to investigate, when to watch, and when to pull the emergency cord. Use a mix of thresholds. Static triggers are simple: a fixed count or rate that, when exceeded, alerts the team. Dynamic triggers adapt: rolling baselines, seasonal adjustments, or CUSUM to catch small but persistent drifts. Organize alerts into risk-based tiers: minor, major, critical, so response matches potential harm. Add guardrails to prevent alert storms: caps per hour, cooldown periods, and correlation checks that merge duplicates. This blend catches meaningful changes fast while keeping noise low and focus high. Consistency wins. Use templates with standard fields: who, what, when, where, so every entry is complete. Capture event details like device model, app version, build number, and usage context. Attach evidence: screenshots, system logs, telemetry, and user reports to speed root cause analysis. Finish with outcome and next steps. Assign an owner, set a due date, and record actions taken. Clean, structured logs make trends visible, support faster triage, and create documentation you can confidently show to auditors. Begin with basics. Verify data quality and deduplicate repeated reports. Next, rate severity, frequency, and impact on clinical workflow. Does it delay care or alter results? Look for causality clues: a tight temporal link to a release or event, technical plausibility, and reproducibility under similar conditions. Then choose a path. Monitor if uncertain, mitigate with a quick fix or workaround, or escalate for cross-functional response. A lightweight checklist keeps decisions consistent and defensible. For SaMD, context matters. Maintain strict versioning so each signal links to a specific release or model. Track environment factors, OS versions, sensor quality, network stability, since they often explain anomalies. Watch for algorithm drift and model bias, with periodic performance checks across subgroups. Ensure regulatory traceability. Link signals to requirements, risk controls, and verification evidence. A solid audit trail: who changed what, when, and why, protects both patients and your compliance posture. Build an end-to-end flow. Ingest from complaints, in-app feedback, logs, and real-world data streams. Automate detection with rules and models, but keep a human review gate for clinical judgment. Use time-boxed SLAs for investigations, hours for critical, days for major, to prevent drift and backlog. Close the loop. Feed findings into bug fixes, model updates, risk files, and labeling or IFU changes. When the workflow cycles smoothly, each signal improves both the product and the patient experience. Measure what matters. Track precision and recall to balance catching true issues and avoiding noise, and watch alert fatigue in your team. Success looks like fewer false positives and faster identification of true signals from first report to verified root cause. Keep thresholds, templates, and checklists as living assets. Review monthly. Adapt to new releases and markets. The payoff: safer SaMD, smoother audits, and a team that moves quickly with confidence and clear evidence.